Welcome, everyone, and thank you for joining the School-Based Health Alliance, the National Association of School Nurses, and the Association of School Superintendents for today's webinar, a toolkit for catching up on youth immunizations and well child visits. I'm Laura Bray, the Chief Operating Officer and Chief Strategy Officer for the School-Based Health Alliance. Please take a few minutes to complete our starting poll, and then we'll move on to our agenda. Before we dive in, let's reflect a little bit about what's happened over the past 2 years since the start of the pandemic in 2020. COVID-19 disrupted both in-person learning and routine well child visits over the last 2 years. As a result, too many children have fallen behind on receiving recommended and required immunizations. We all want our kids to be back in school safely, and that means getting caught up on immunizations that were missed. Today, we will focus on the toolkit developed to help educators, healthcare providers, and school nurses encourage and enable families to catch up on immunizations and well child visits. We'll be hearing from several people who have firsthand knowledge about the problem, different solutions, and continuous challenges. First, we'll hear from Molly Tickner, who is the creator of our toolkit. She'll walk us through the document and give suggestions on best ways to use it. Then we'll meet 2 experts from the field, Maureen Murphy, a nurse practitioner at the River Rouge High School SBHC in Michigan, and Dana Shoemaker, a registered nurse at Nationwide Children's Hospital Care Connection in Columbus, Ohio. And finally, we'll be talking with representatives from the National Association of School Nurses, Robin Wallen, and Hedi Site from the School Superintendents Association. They will speak to their knowledge and experience dealing with their responses to recent declines in immunizations and well care visits. But before we get started, I want to go over a couple of reminders. All attendees are in listen-only mode. To ask a question during the session, please use the Q&A icon, which stands for question and answers, that appears on the bottom of your Zoom control panel. When using the chat, please select all panelists and attendees before typing your message so everyone can see it. And lastly, please complete the evaluation poll questions at the end of the presentation. At the School-Based Health Alliance, we believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is the solution, bringing healthcare to where children already spend the majority of their time, in school. When schools, families, and students work together, along with the community, students win. We want to have a special thank you and shout outs to our partners, the School Superintendents Association and the National Association of School Nurses, who helped us develop this toolkit over the past several months. We collaborated with leaders from these organizations to complete this amazing project. And especially a shout out and thank you to Merck, who made this toolkit possible by funding this awesome project. Now we'd like you to meet our team. These wonderful people, our dedicated individuals, have worked together over the past 6 months to bring together resources needed to respond to the issue of catching up on well child visits and immunization. Thanks to all of you for your hard and dedicated work. Now let's go over what you're going to get out of today's webinar. So by the end of today's webinar, you should become familiar with the decline in immunizations and well child visits for all youth due to COVID-19. Gain knowledge on ways to address the issue and improve immunizations and well child visits by using resources from the toolkit. And lastly, describe how other healthcare providers have addressed obstacles to immunizations and well care visits. Now, I would like to announce, I'm thrilled actually to Introduce Molly Tickner, an SBHA consultant who created the toolkit. Molly is a licensed professional counselor and art therapist with over 25 years of combined experience within the mental health, school systems, and social services field as a clinician, supervisor, and educator. Molly is a consultant educator for trauma-informed systems and school-based healthcare, embedding her vast clinical experience and knowledge into this curriculum. Now we're going to see from Molly's screen, she's going to walk you through and share and review the toolkit. Molly?
All right, hello everyone. I hope everyone's having a fantastic day. I want to thank the School-Based Health Alliance for giving me this opportunity, and I'm super excited that you all will have access to this wonderful information that will continue to be updated over time. So just taking a quick walkthrough, the link is up here. We will share the link to the live toolkit with you at the end of this presentation so that you have access to it. We try to put it into different buckets. If you look at the toolkit itself, after an introduction about why school-based health centers are a great resource to help overcome the barriers to access to well childcare visits and catch up on vaccinations, there's a little bit of an introduction. As you walk through the toolkit, you will see a lot of data and information in the beginning, as well as we had in-person interviews with individuals in school-based health, school systems themselves, and you'll see quotes from them on their best practices examples, as well as resources available from their experiences. So once you go through the introduction, we bucket it out into the impact of COVID-19, and most of you, this is not new news in terms of some of the statistics, but this is a great resource to come together to pull up basic resources, basic information in terms of the slope and the decline of immunizations since the COVID-19 pandemic. So these resources are available for you all to utilize as you're talking with stakeholders. And then we get into a few definitions. What is school-based healthcare programs, immunizations, as well as what is a well childcare visit, and with resources in terms of what various types of school-based health centers are out there and how they work with school nurses. The buckets themselves are divided into specific resources and information for school and/or district administrators, community healthcare providers, and school nurses. I will say that there is a lot of overlap in some of the information and some of the resources in each bucket, because oftentimes school districts and/or healthcare providers might not have the multiple layers of administrators, or the school nurse is actually responsible for creating the MOUs, the memorandums of understanding, or those relationships and partnerships. And so we did our best to duplicate that across the buckets, but also include specific information within each population. So if you click on learn more under each bucket, we'll start with the school district administrators. You can see that there are 3 specific areas. So considerations for partnerships. We included some key information about why partnerships are so important, how you start creating those partnerships. If you're a school district administrator and you don't currently have a healthcare provider in your school or a formal school-based health center, we provided some best practices in terms of how to connect to a healthcare provider in your community, as well as the resources associated with those partnerships. So considerations for developing an MOU, sample MOUs from some of our providers. We also included data sharing agreements in terms of how do you share that data between the healthcare provider and the school district, and checklist. And then some outreach and engagement strategies for healthcare providers in terms of how do you create those effective partnerships, partnership checklist and toolkits. So those are some things specific to partnerships. Each bucket has these 3 categories. So the next category is communications and community engagement. We tried to, again, keep them specific. So if you're a school district administrator, looking at how are you communicating with your staff? How are you communicating with them in terms of what events are coming up or what information to share with the caregivers, the students, how to engage caregivers and students in the process. Customizable templates. So if you click on these links, it'll actually take you to specific templates in terms of how to communicate between schools and healthcare providers, even social media toolkits in terms of graphics to utilize, individual memos. We tried to create memos. We gathered a bunch of memos in terms of if you're doing a huge phone release or a social media mass event and communications out. And so we really wanted to make this tangible resources for you to be able to click in one place and have the ability to find everything you need. Oh, let me scroll back up here. So under the community healthcare providers, again, you'll see the three categories. Again, some of the information here, if you are a healthcare provider, is specific to you. The resources are a little bit different because they're kind of more focused on that healthcare aspect of it. Consent forms, HIPAA versus FERPA, guidance for nurses and school-based health providers. And we tried to create and find and locate things specific that were in multiple languages. And so there's direct links to that. Again, you'll see a repeat in some of the resources that you saw in the other section for school district administrators in terms of the MOU and the partnerships. We even included ones if you're sharing the responsibility for the school nurse. Communicating with customizable templates for communication in schools and healthcare providers. So just a lot of resources all in one place to hopefully make it as simple as possible for you all to locate what you would ever need in order to help bridge the gap and communicate out and engage your community, engage your school district, and engage all of your staff. The school nurses one, shout out to this. We really wanted to make it focused on what are some of those resources that we know our school nurses have been really wanting. We utilized our partners really in making sure that we had a huge list of resources, social media communication toolkits, ways to engage youth and family in terms of flyers and vaccine confidence and dispelling some myth about getting vaccines and why it's important to catch up on our well child visits, and a lot of graphics and images to be able to reproduce. What I will say in general about this whole toolkit is all the resources that are under school district administrators, healthcare providers, and school nurses, we created a general resource tab where everything is in one place. So everything related to partnerships that are in those three buckets are in this resource list. Everything related to communications and community engagement is in this resource list. And then everything related to operations and logistics. So here's speaking to, what if I wanted to do immunization or a vaccination clinic? What if I wanted to do a well child drive-up clinic? These are all of the resources that are underneath all the buckets. So if you're struggling to find something in one of the bucket that's related here, you should be able to find everything we have under general resources. And then the last bucket we have is those best practice case studies. One of our colleagues did a really great job of interviewing individuals from school-based health centers or community health centers who have lessons learned and what they did to overcome that gap of addressing the vaccination and immunization gap and increasing their well child visits. So we included those interviews as well as some of the resources they have to share. So happy to take any questions from here. And again, like I said, this will be updated as new resources come in and new information and new data comes in.
Oops. Okay, Molly, I have a question for you.
Sure.
Can you start off by telling us why the well-care visit catch-up and immunization catch-up is so important right now when we're trying to also juggle catch-up or just mental health and acute care and all of that? Why is this so important?
Well, specifically, I come from a healthcare and a school background, and I know firsthand, even before COVID, that catching up on immunizations in order for our kids to be successful in starting school was a challenge. And with the COVID-19 pandemic, we were all focused on isolating and trying to keep safe, and so we saw a huge drop in those routine vaccinations and well childcare visits. And well, childcare visits especially, and there are some really great graphics in the toolkit under the intro section that talk about what is so important for a well child visit for those kids from 0 to 6. What are we focusing on? Making sure they are meeting their developmental milestones and making sure that they're progressing and their vision and their hearing is ready. So when they go to school, they're ready for that. And then there's another one for that school age, kind of that elementary school. What are we looking for? Why are that so important to get that annual well childcare visit? And I think the vaccinations, you're going to hear from some of our presenters in a little bit, is those vaccinations are so important to not only maintain the health and wellness of that child, but also the health and wellness of that entire school community. And come up with some really great ways to not only catch up on those vaccinations, but when someone's coming in for a vaccination clinic at a school-based health event, that's a great opportunity to say, has your child had a well child visit in a while? And can we screen for their vision? Can we screen for their dental and screen for their hearing to make sure that they can be successful in school? So there's definitely resources available in the toolkit itself on how to have those conversations and how to even set up a vaccination clinic and just share those resources with families and caregivers and staff in the school, as well as you hear from our panelists about some really great ways that they're doing for that.
Great. I got another question for you. I'm from a community health center, and I did partner with my school just to do a one-shot COVID clinic. But what you're talking about will take a lot more than that. So, what are the resources in the toolkit? Where do I find those to help me look at how I can partner with them to just do well care visits or routine immunization catch-ups?
Sure. So and I'm not able to share my screen right now, but if you go to, if I can, no, there we go. I'll go back. So if you go to, let's say, school district administrator section, and you talk about operations logistics, there are a wealth of resources in terms of school vaccination under on-site school toolkit. And if you click on that toolkit, it actually has information about, okay, so how do I engage in a conversation with that healthcare provider? Or as a healthcare provider, how can I engage in a conversation with my school? Because we have this service that we can offer. And it talks about the cool thing about some of these toolkits is actually even has maps. Like, how do you set up a vaccination clinic? How many staff do you need? What kind of communications do you have with your staff in order to market the event? And how do you engage your caregivers and the parents in attending the event? In a lot of the toolkits and the resources underneath the operations logistics under both school district administrators and school and community healthcare providers has information in terms of even, what are some of those releases that you need and what are all the considerations that you need in order to host a clinic or even have ongoing conversations about having ongoing vaccination events, not just that one vaccination event in the beginning of the year. One of the toolkits that we picked out was actually a drive-through curbside immunization toolkit. So coming up with those really unique ways to host events to maybe make people feel better so they don't have to actually come into the school. So there's just a lot of different ways that this can happen depending on your community and bringing everyone together to have that conversation.
Okay, Molly, we're almost at time. I got one real quick question. And I'm just wondering, they're wondering, is there any guidance on how we can get PCPs to do the full well child check? A lot of times all they do, or all we seem to get from them, is height, weight, and blood pressure.
That's a good question. I might actually ask any of our other panelists if they can help answer that question. I think it's important to, and I'm not sure who's asking that question, I think it's really important to encourage the caregivers to have that conversation with their primary care physician in terms of like, here's what I know that a well child visit is supposed to be screening, and make sure that they're asking those right questions. There is in the toolkit a checklist in terms of what are those milestones and what are those things we want our well child visits to entail, except for instead of just those basics, the vision and the dental screenings and those kind of things. And so I think it's important that we communicate to our caregivers and our parents and educate them on, here's what I would be asking my child's physician to do in the well child care visit.
Okay, thanks. So we're out of time for this segment. And if you have more questions, continue to, for Molly, keep typing them in the chat, in the Q&A box, and she will answer them during the session. And thank you, Molly. And I'm going to hand this over to Eileen Sparber, who was our toolkit program coordinator, for some expert presentations.
Thank you, Laura. Now we'll have the opportunity to hear from two experts from the field. They have been on the front lines during the pandemic and will share with us their experiences. Our first speaker is Dr. Maureen Murphy. Maureen is a family nurse practitioner who works for Beaumont Health at the River Rouge Teen Health Center and as an assistant professor at the University of Michigan Flint School of Nursing. She is uniquely positioned to discuss today's topic as she has worked as a district nurse, has a professional nurse certificate, has facilitated the opening of 6 different school-based clinics, and has worked with school-age children providing primary care for over 20 years. She zestfully believes in holistic care and authored the concept of the curbside immunization event that Molly just mentioned, and assistance with social determinants. These findings have recently been published in Nursing Administration Quarterly. Maureen?
Good afternoon, everyone. I'm so excited to be with you today. So much information to share, so excited that we can find an organized way to help our children. So with that, let's get talking about what we did way back when and how we made a difference. So let's roll back that bus, if we will, and let's think about it for a minute. Our project really started from a motivational webinar that I attended, where they really just talked about the overall processes of any pandemic. And I really could relate to it. And I'm sure you could too. I mean, when you think back, all that immediate mortality, fear, and morbidity that was going on. And the second wave that came through was really where we would find somebody with an urgent issue, but it wasn't pandemic related, refusing to go to the ER. So somebody who may be having a heart attack wouldn't go, right? We all remember that. And the third is really what we're here to talk about. It is that interruption of care for chronic conditions and prevention care, such as immunizations and well visits. And the fourth wave that this webinar talked about, and still very, very much present for us, considers all the post-traumatic stress, especially us in the medical field and in the school districts and really anyone, and the psychosocial burnout from it all. And certainly, as we know, inflation is crazy right now, the economic impact. And this is a busy slide, but in a nutshell, this is kind of what we did, right? we realized, like Laura was talking about, was that there truly was an interruption of care in Michigan and truly nationally, particularly in the adolescent population at the beginning. Parents were totally very much afraid to come into the buildings and seek care. And in my particular district and many school-based health centers across the nation, there are many issues of social determinants, right? And issues were definitely on the rise for food insecurity. And so we need to understand that even before COVID, that there were definitely some health disparities that arose or had been present within immunizations that correlated to race and poverty. And we really tried to nut and bolt and try to figure out a way to kind of handle this, creating better access to care in this very unique situation. So if you look at our activity, our process flow, we attempted to create a pre-registration process. We did this because we really needed to know how many people were going to be showing up and how many immunizations we'd need to have on hand, whether that would be VFC or private. Certainly we had the walk-ins, but we wanted to have a real count. So we did that. We did the COVID screening that we're all so familiar about, but back then we had to process all that out. They drove up to an immunization tent, and they got out of their tent and had each little, as you can see in that picture to the top right, they all had a little area where they could get out with a table, and we provided their vaccinations there. So it was the same process that we would give inside a clinic, but it was outside. We even set up a temporary lab, had a mindful moment so that we were really cognizant of what we were doing. And here is the best part of all of this, is we realized with our post-immunization waiting period, which was best practice to wait 15 minutes, we assessed for social determinants of health. We had a little survey. How did we do? What did we find? And we provided food to anybody that needed it. And some of our results were amazing. We found that 97% of our clients that took immunizations were up to date post-immunizations. 100% of the families felt that the precautions that we did do, that the process was easy and safe, and a little over half said they probably wouldn't have come if we didn't have created this kind of event. And the really ticker here is that 48.2% of this population, concealed the fact that they had some issues about social determinants. And I was so happy that we were able to give them some references and resources, and 34.5 had a food insecurity. So I know some of you are sitting there going, well, how the heck do we make this all happen? What can we use as guidelines? And I will tell you that I used two things. One, I put it under a model of conceptual framework in the sense that I am not just talking about the person, but I'm talking about the family, the kind of genuine cultural appropriate perceptions that we give to our patients, as well as how is our community feeling. And I don't know if I would have gotten all of that if I wouldn't have thought about like the social determinants, if I didn't use an umbrella or a model or a framework to help me. The other thing I will tell you is I use the logic model. And I can tell you that I think it's an absolute wonderful tool. It helps you organize everything. It helps you know what you're going to do in an activity level. And then it helps you evaluate. So don't forget those. And then truly, I got a focus group. So, they say that many, many minds create great things. And this is really the truth. We put everybody together because when you do an event that's a little bit different, you need to think of the what ifs. For instance, we lost power, but we had a backup plan. We were worried that if the computer system would go out, what would we do? So we worked through all of those kind of issues, or at least the potential issues, in what we call a SWOT analysis. Highly recommend it with a focus group approach. And here's just some fun pictures. This is up, we were on we didn't get any extra money. We were on, no cost additional, which was great. But you can see it was very effective and the balloons draw people in. This was, of course, before we started that day. And what I will share with you is that many school-based healths or many disciplines together really create a good event. So we were able to interdiscipline approach with our social workers. And this is a picture of one of our social workers here, and he's getting ready to give some food to somebody. But we had already done the survey. They were right there. And I tell you, one particular amazing story is they said, oh, you're a social worker. And, you know, we all know COVID, right? And signed up immediately for service. So somebody had said, how can you bring the child in for a well visit? You know, I think this period, this 15 minutes is a wonderful opportunity to create an opportunity for that parent to really understand the importance of coming back, right? So put that carrot out in front of them. What do you really want to have them check? Maybe it's their heart. Maybe you want to make sure they're safe when they play sports. And last but not least, what I really want you to hear from me is this is always an opportunity in crisis if you look at it the right way. This curbside immunization made us rethink and redesign. It was definitely a bridge back to clinic services. And I will feel strongly about this, that social determinants could and should be assessed at every attempt that we can make. This also served as a potential future platform. We ended up doing flu all over the community, to churches and wherever, as well as the COVID-19. So I encourage you all to dive deep into that toolkit. I thank you for your time. Have a great day.
Good afternoon, everybody. I'm Dana Shoemaker from Nationwide Children's Hospital, clinical lead over our school-based health centers. At Nationwide Children's, we are lucky enough to have 14 school-based health centers. We operate 2 mobile units. We see children age 3 to 20 with over 85% being Medicaid or uninsured. And we have been able to serve over 3,000 unique patients. So I'm sure we're not unique to COVID affecting us, as well as it affected all the other school-based health centers across the nation. You know, with students not being in school, we had to think outside the box a little bit of how we were going to still meet the needs of our patients. So a little bit like Maureen, we implemented a roving vaccine clinic. As you can see, it's very simple logistics. Got some totes from Walmart and put all of our supplies in there, and then used the vaccine cooler to transport our vaccines. We did have high demand, continue to have high demand, and then knew that we would have growth potential with the COVID vaccine. We use flexible locations, schools, parking lots, apartment complexes, churches, in any event. We began in April of 2020 with our initial focus on childhood immunizations. We work very closely with our local health department. And at the start of COVID, they were primarily focused on COVID and not regular childhood immunizations. So we tried to pick up some of that when they started their focus on COVID. And then, as I'm sure everybody across the nation, once the COVID vaccine became readily available, we turned our focus to the COVID vaccine clinics. And then we, like I said, we partner with the health department, and we did do a multi-county reach. This, yeah, and that picture's just happened to be a gym that we were in, one of our first clinics that we did set up. And we have a template that we had built into Epic to pre-register these kids. Again, we also took walk-ins, but on our template, we had 500 slots. So we were able to see 500 students, or really anybody of any age that was eligible for the COVID vaccine. And we were going out 3 days a week. So each week we were hitting about 1,500 people to get the COVID vaccine. We completed 25 roving vaccine clinics of just regular childhood immunizations, and we were able to reach over 1,600 patients. That was a 10% increase in our overall patients served compared to 2019 and 2020, just by implementing our roving vaccine. This is, we're set up here at a YYMCA. You can see we have signage outside. The space is a little bit different than the big gymnasium that we were in. But again, you know, we can work out of any space allotted as long as we can set up our equipment. Couple more fun pictures. Again, this was a gymnasium where we were set up. You can just see the multiple different tables where we had vaccinators. This first picture was our very first clinic, and we're holding up the COVID vaccine. We were so excited. It was our first one with COVID, and that was our 500th dose. So that was kind of fun. And then you can see the girls prepping the different COVID vaccines there. It looks like we're in a classroom. So the school health COVID vaccine clinics from May to June, excuse me, we completed our first sprint of 6 weeks. We reached 10 school districts. We worked with them to provide transportation. We provided over 5,000 doses of COVID. Excuse me. And we referred all of the kids that we were seeing to primary care who were behind on the routine immunizations. Excuse me. So again, while we had these students in front of us, we were checking to see if they were up to date on their well child care. And if they weren't, then we were trying to refer them for well child care or their routine immunizations. Then June and July, we completed the roving vaccines for the 12 to 15-year-olds. We reached 10 school districts, and we worked with school leadership to provide community outreach. I am so sorry. And there we were able to provide over 1,600 doses. I promise I'm not sick. I got a tickle in my throat. Then the 5 to 11-year-old approval came in November. And again, we hit 10 school districts with the ongoing clinics. And we did 7,000 vaccines with 35 school-based COVID vaccine clinics. Next. So if you look at these numbers, they're pretty impressive. We actually completed for routine immunizations, including flu, 30,000 vaccines. And then for the total COVID vaccines, over 52,000. And we hit 226 clinics. So let me tell you, my team was busy and they were tired. Next, please. I just wanted to show this slide. It's pretty impressive. This is Nationwide Children's as a whole. The hospital itself had a vaccine clinic set up inside the hospital, which is in the blue. And I just wanted to show how impressive School Health Services was able and what impact they were able to make in the orange. Next. And then focusing on well child checks. Next, please. We have Partners for Kids. It is an accountable care organization affiliated with Nationwide Children's Hospital. And they are responsible for over 300,000 children throughout Ohio. They do provide care coordination and navigation for the patients that are enrolled in the Medicaid plan. And we work with them yearly to identify patients who are students already in our school-based health center. and determine the status of their last well child check. We then match the rosters against insurance claims to come up with a list of who's due. And then we do outreach. We call them and remind them, you know, they're due for their well child check, and see if we can get them assigned in our clinics. Next. That's it for me. I appreciate your time. If you have any questions, I'd be happy to answer them. But just, you know, just like us, in a time of need, you have to think outside the box and, you know, meet the kids where they are. And I appreciate your time. Sorry for my voice.
Thank you so much, both Maureen and Dana. Hopefully we can all learn from them and incorporate some of their ideas into our daily work. Now we're going to continue with what we refer to as our fireside chat. As was mentioned earlier, leaders from each of the 3 major organizations have worked as a team over the past 6 months to develop this toolkit. We've asked members of the National Association of School Nurses and the Association for School Superintendents to speak about their on-the-ground responses during the pandemic. First, there's Robin Wallen. Robin received an MSN and a DNP from Yale University and is currently the director of the School Health Division for the Fairfax County, Virginia Health Department. She has 25 years of experience in school health services as a school nurse, district school health leader, and public health administrator. Her passions include supporting school nurses in school nursing practice and designing school nursing interventions which support student health and achievement. She served on the board of directors for the National Certification Board for School Nurses from 2015 to 2018. Dr. Wallen is a certified pediatric nurse practitioner and a nationally certified school nurse. My question for you, Robin, is what innovative approaches has Fairfax County school nurses incorporated to make sure students catch up on their immunizations?
That's a great question, and it's definitely on our radar. We have just been overwhelmed by the backlog of students needing immunizations. This has happened because immunizations were postponed during the pandemic. People chose not to get regular well child visits. So we now realize that we have quite a backlog. So in partnership with our school district, we have hosted several school located vaccine events. And these are targeting the schools that have the highest number of students that are not in compliance with the mandated vaccines. And basically we focused first on high schools. And we've had some mixed results and have found that the locations, the schools where this intervention is working the best are the schools where the school administrator and the school health staff and the school nurses are all working collaboratively with the health department to ensure that the communication is sent out and that lots of families are aware of this great opportunity to get their students vaccinated at school. We also had the opportunity to apply for a grant through our Virginia Department of Health, and that is helping us to stand up a team of nurses that will be able to go into our schools throughout the next 2 years to deliver school located vaccines. So we're really hopeful about that opportunity and hope that that's a key piece of the puzzle, if you will, as we try and address this problem. I mean, definitely partnerships are so very important. The other piece I think that's important is the relationship. So one of the things that school nurses have the opportunity to do is care coordination with families. And it's often in that relationship between the school nurse and families where change happens. So they can serve as the intermediary, if you will, between families and the healthcare system to get these vaccines. So we're learning a lot. We've needed to translate forms into 9 languages, and we're embarking now on a public messaging, hopefully a unified public messaging strategy to to start our summer and get our students vaccinated before school starts in August. And one last project that we're also working on is an NASN grant to explore vaccine hesitancy, specifically COVID vaccine hesitancy in school-age children. And we've learned a lot from parents about the reasons they choose not to vaccinate their children. And we are using motivational interviews and strategies, our school nurses are, to try and change minds and also just link families to care. So some really excited initiatives are going on currently in the school district that we serve.
Thank you, Robin. Next, we'll hear from Hedi Site. Hedi is the superintendent of schools in Umatilla, Oregon. Umatilla schools serve a rural agricultural community in Eastern Oregon, and Hedi has served as the superintendent of their school district since 2007. She has a deep passion for rural education, especially for students of poverty and emerging bilingual students. She believes in the power of public schools to provide access and opportunity to each and every child. Hedi, can you tell us about your biggest challenge in getting students vaccinated?
Was actually access to healthcare as a whole. We didn't have a lot of providers in our community. And in fact, we only have the one provider now. And so we really had to think outside of the constraints that we were facing and think about how we could rethink school-based health centers to a community model that was a partnership between us and that partner. Are you able to hear me?
Yes, thank you, Hedi. Hedi, can you also answer a question about, have parents been hesitant to participate in your efforts to get students immunized?
So we start off with registration, and at registration, parents can sign up for our school-based health partnership. And if they do so, then that means that we take students to the doctor for their well child checks, as well as for any mid-year illnesses that are minor that they may have. And so when parents sign up for that, they also give us permission to vaccinate their children. And that begins the conversation. So because of that, we really haven't seen an increase in hesitancy. Instead, what we've noticed post-pandemic is fewer people participating in the partnership. But we really think that has a lot to do with the fact that registration has been primarily online over the last year. So as we get back to more traditional registration models, we do expect that we will see those numbers pop back up again.
Thank you very much, Hedi and Robin. Laura, I'll turn it over to you to handle questioning.
Okay, great. So I have some questions for Maureen and Dana, Robin and Hedi. So if you all want to unmute yourselves and come join us on the screen, I'm going to start with one for Maureen. How do you use scheduling templates with patient populations, walk-ins in particular? They create a bottleneck for our intake process. And how can you accommodate them?
Right. It's absolutely true. So when you do an event, we really attempted to create appointments because that would help us know what we needed, what was, as we were trying to get our supplies ready. So that was the most encouraged. However, what we would do is leave, it was that drive up for us. So we would leave one lane open for walk-ins.
Okay. Dana, have you had similar? You're muted.
Sorry.
Great. Okay.
Yeah, our template was built to max out at 500, and was 5 or 10 an hour that would block the template when people pre-scheduled. And so we were a little bit more limited in the walk-ins we could take based off of the people that pre-registered, because we we took our COVID doses from the main hospital, so they were already drawn up, so we didn't have the prep time involved since we were seeing so many people at one time. So our Epic team was wonderful in building our template. So once it was, you know, a time frame was filled, no one else could schedule into that time frame.
Okay. Another question that both of you can, both Maureen and Dana can probably answer. When offering your routine vaccinations, do you offer or utilize the Vaccine for Children's program?
Yes, we did. And I definitely had a partnership with the health department. They were fabulous in our area. Give a big shout out for Wayne County Health Department, because if it wasn't for them, I don't know if I would have had enough guts to really try it. So they were really good, and they helped me figure out how much I might need on hand. But I really had to work out a process about keeping my Vaccine for Children separated from my private, and we wanted to offer both. So that's why I say that SWAT, that working it through in a focus group, you know, don't be afraid to get your people together. Great minds do come up with great things.
Dana, did you have similar?
Yeah, so we're a VFC provider. So we offer VFC every day in our daily work. So it was really no different with the roving. But yes, the similar, you know, we have to keep our private and VFC separate. I would say 85% or more of our population is VFC.
I agree too.
Yeah.
Thanks. Okay, one more question for you two, and then we'll move on to the others. So how do you monitor the temperature on the vaccine coolers?
So we use data loggers, and we just carry them with us in our cooler. And then we have created an hourly check sheet that we monitor the temperature. And we've not had any issues. You know, the coolers are expensive. I think they're anywhere between $500 and $800, but they definitely sustain the vaccines. We've had them out up to 8 hours, and they've been stable.
Right. There's also, at least I reviewed that I used, I think it was the CDC Toolkit, which allowed you to kind of go through a checklist system to make sure that you were taking your immunizations off in a safe way. You know, what was the temperatures before you went, you know, so I would definitely look for that within the toolkit. I'm sure it's there. Best practices for you know, because you're really going on the road, even if you're in a parking lot, you know.
Yeah, that's true. Okay, thanks to the two of you. Now I'm going to move on to a question for Robin. How have school nurses pivoted to handle all these new COVID responsibilities, along with checking up on other immunizations and well care visits as well?
Yeah, it's a challenge. and right now, as maybe you all are too, we're in another wave of significant infection, and we're seeing rates of outbreaks in our schools higher than at any other time in the pandemic. So it's a huge challenge, and it's a challenge for schools also, who are maintaining you know, the databases with immunization records. We put the responsibility for immunization compliance on schools, but there's so many other demands on them. Oftentimes it falls into the lap of the school nurses. So it's a challenge. I can definitely tell you my peers would agree with me.
Okay. And Heidi, this will be the last question. Have you had other health departments, community health centers, other providers come to your district and ask to partner with you or your schools in these kinds of efforts, immunizations or well care visits? And if not, how would you welcome them or communicate with them that you'd like them to come in and do that?
It's been very simple for us because there's only one provider in town. And so we are the only game. So therefore they're the only partner. And we're very thankful for their willingness to be so cooperative and be such a wonderful partner. Our county health department is a wonderful partner as well, though, in different ways. So during COVID, for example, we partnered with them to provide community vaccine clinics for COVID. as well as student vaccines for COVID. And we did that in cooperation with that healthcare provider. So together, the county health department and the provider worked together and then used our school facilities and our school staff and volunteers to make that happen. So I think the one thing that really, if we can just keep the focus on kids, keep the focus on keeping healthy learners in school, and then the adults can work together around that mission, it seems to come together.
Did you find the consent process difficult to get the kind of consents you need for all of this?
No, because it's part of our registration paperwork. And I really think that's the essential component, is when students are registering for school, we already know if we have consent or not. And that pretty much takes care of it right there.
Okay, great. Well, thank you to all our panelists and presenters. And now we're going to have to come to a close, but we want to close with some announcements. And we'd also like you to complete our evaluation poll. So first, here is the link to the toolkit, which I know many of you are asking for. And also Harper's going to put it in the chat box now. But you can find the toolkit on the School-Based Health Alliance website using this chat. Also, we have launched our first census in over 4 years. And if you're a school-based health center, new, you don't even have to be a year old anymore. If you're new and you're out there, we want you to complete the census. This is how we get counted. This is how we're able to advocate for federal money, help you guys advocate at the state level. It can tell the story. It can do more further research and other kinds of data sets. It's a real opportunity. So we encourage you to visit the website and the webpage for the census, complete that. We're working in partnership with the University of California, San Francisco in this effort. And there are incentives this year, gift cards for your participation. So please do so. Also, we want to remind you that it's time to register for our conference if you haven't already done so. Please visit our website for more information. We do have 12 till 5 Eastern time sessions with some we're not having a vendor location, but what we are having is from 11 to 12 Eastern time, we're having people come on with their products that are, some of them might have a fee charged with them, but some of the latest and greatest services available, or questionnaire, risk assessments, different things like that that you can learn about and talk to the folks that have them. So that'll also be offered. In addition, we want to also thank you for attending this webinar, and the recording will be posted on our website in the next few days. And please feel free to email us if you have any questions at the info@sbhforall.org box. And I'd like to again say thank you to everyone, and thank you to all the participants for attending today's webinar. Please